What's going on, guys? My name is Steve. Thank you for stopping by my channel. I'm just an American guy on a journey to discover my British and Irish ancestry. Today, we're going to be reacting to how the United Kingdom's healthcare system works. I understand that the UK has a universal healthcare system called the NHS. I believe that stands for National Health Service, if I'm not mistaken. But beyond that, I really don't know the ins and outs of how the NHS operates. For example, I understand that taxpayers ultimately pay the cost for the NHS, but does every single taxpayer across the board pay the same amount, or is it based off a percentage of income? And also, do lower income people pay into the NHS, or do you only start paying in once you hit a certain income bracket? And also, I'm wondering things like, do you have copays when you go to certain medical procedures? And also, does the NHS cover every single medical procedure you would ever want? For example, could you go get cosmetic surgery, or is it more for kind of emergency purposes and things like that? I'm also curious, is dentistry actually included in the NHS? Because that would be really interesting, because we generally don't have dental stuff covered with health insurance here. You have to actually purchase separate dental insurance, and generally the dental insurance is absolutely horrible. It doesn't really cover anything. So there's really not much point in dental insurance for the most part. But obviously, the universal healthcare system in the UK is quite different from anything I've ever experienced. I live in America where we all basically have to get private health insurance, except if you're on Medicaid or Medicare, which is usually, if you're after retirement age, you generally get some form of health care provided, but it's generally lacking in a lot of ways. And a lot of people purchase supplemental health insurance when they get older as well. And people that are really poor or on the low income spectrum generally have their health insurance provided to them by the government for free or at a very, very low cost. But overall, the two systems, I understand they're completely different. And so I kind of want to better understand what the UK's NHS system looks like. So let's go ahead and check out how the United Kingdom's healthcare system works.
Super Tuesday came and went, and the Democratic presidential race is narrowing to two very different candidates: far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to show us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for all will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than any other developed country.
Oh, I wanted to see that real quick. Let's see. So yeah, we spend more than any other developed country. UK kind of right here in the middle. Mexico doesn't spend hardly anything. I wonder how Mexico spends so little on their health coverage. I understand you can go to Mexico and get pretty good health coverage for healthcare for really cheap, honestly. Same as Thailand, but I don't think they consider Thailand. I don't know. Is Thailand considered a developed country? I don't think it is. But it's not quite third world either. But so anyway, but we're talking about the UK. UK's 4K per capita. We're at, what's that, 11 roughly?
Any other developed country. There's one country that spends less than half what the U.S. does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming? In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US.
Woo! The crazy thing is, how is that happening? Because I don't think they necessarily are meaning that every individual, because I don't think every individual in the UK is paying $4,000. So this is obviously what what is total spent per person on healthcare across the board in the US and the UK. That's insane. Look at that difference.
That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
National Health Service, okay.
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
That's so interesting to me. Like, you literally can go to the hospital and you never even have to think about getting a bill. I mean, is that literally accurate? I mean, I think it for the most part is, but is that literally accurate across the board, no matter what? Like, you can go to the hospital for any reason, go to the doctor for any reason, and like, you never have to worry about getting a bill. And you also never literally have to go and pay a health insurance bill each month either. That's so crazy, man. I can't even imagine that. I mean, that's how different our systems are. I can't even imagine that experience. It would feel surreal to be able to go to the doctors and not even have to think about what it's going to cost.
The thing about the NHS is it's a risk sharing system. So everyone pays into it through their tax. Right. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
And that's something I wanted to clarify. I did a couple of those videos where, British people were reacting to the cost of American healthcare services and stuff. And when I was talking about it, people seemed to assume that I thought that it was free. And no, I know there's nothing free. If you're getting some sort of service from the government or something, it's coming out of taxes. That's 100% fact. You can't pay for it otherwise. But what it is that because it's taken out of your system, it's almost, out of your check or out of your income, or you pay it at the end of the year. If you own a business, you pay it towards your taxes. It feels like the federal tax, I'm guessing, federal income tax almost is how it feels, because it's just an automatic thing, basically. So it's not free, but you don't feel the pain of having to shell out that money at a time you need a health service. So that's just it's just such a different dynamic. Can't imagine it.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems. And that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
So what do you guys pay to to the NHS? Can you see it on your check? Or if you have a business, do you automatically know what you need to add to pay to the federal government for the NHS specifically? I'm just curious, what is that percentage? Is it 3%, 5%, 10%? It sounds like the percentage is the same for everyone, no matter how much or little income you're making. Is that accurate?
I call that socialized medicine. Government provides the care. Government pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialized medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Well, what I would like to add to that is that it doesn't really matter what you call it. It matters, do the people that are experiencing the system, do they feel like they benefit from it? It doesn't matter what anybody anywhere in the world calls it. Has it been a net positive for the people that are experiencing it? And obviously, on the other side, over here in America, there's no way I can judge it one way or the other because I haven't experienced what it's like. All I can do is trust the people that, that comment on this video, perhaps, and, other videos that tell me, they're living in that system. How's it worked for you? Have you enjoyed it? Has it been a net benefit for you? That's the type of, that's all I need to know. I'm not gonna listen to someone that lives in America that's never experienced this type of system try to tell me one way or the other if it's good or bad. I will want to hear directly from the people who are actually experiencing it. And so I'm kind of curious, guys, for everybody who's in the UK under this system, what do you think about it? Has it been a net positive or a net negative for you? Has service been excellent or has it been poor? Do you feel the amount of money you're paying into that system, do you feel like you get out of it, what you should for the money?
The UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly. But
I didn't know
all
that.
of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs. But those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK
Not
than
the
they do in the
57%, but
US. Unlike with other universal healthcare
prescriptions.
systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace.
This is part of what I'm really trying to wrap my head around. If everyone can literally go use the NHS services for basically no cost out of pocket, you're already paying for that service in your taxes. Why then would people choose to go and pay out of pocket for a private doctor or something like that? Is Is there some benefit from it? I know that he talked about, there's increased wait times, which is something that, that is a talking point that you hear in America about Canada, about the UK, about Australia, about other countries that have similar health services, I believe. But anyway, you hear that the wait time to get certain services is much longer. And is that one of the benefits of using a private doctor, private insurance or whatever in the UK?
In the United Kingdom for the course of several decades, that's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, It's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work.
Why would cataract surgery be? That's kind of interesting. I thought it would have been, I don't know, something related to some sort of heart disease or cancer or something like that. Cataract surgery is the number one surgery provided by the NHS. It's interesting.
Implications in terms of staffing. Private sector doesn't train its own staff. It takes it from the NHS. It cherry picks, takes the low risk patients, not the high risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals.
That's something I really haven't looked into either, is the Brexit. I understand the basics of what it is, but I don't really understand how it affected the UK positively or negatively. I don't really understand. I know it was like on really thin margins, like 50-50 almost, or maybe it's 51-49% wanted to leave versus not leave. But, I wonder how that's affected people in the UK since that's happened. Because what's that been? Is that like, what is that, 7, 8 years now or something? It's been a while.
The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
The problem is that the NHS is already on the table. It has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone. And they haven't rushed to do that.
Trade negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era. Well,
I'm guessing a few of the things they're talking about now have come to pass. I think this video was 2 or 3 years ago, but this was the most recent video that looked like, based off of who it was and the thumbnail and stuff, that looked like it would be a good way to learn about it. I haven't really seen many videos that look like they go into depth, especially recently, or that were made recently.
With regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
Yeah, that was really interesting. I learned quite a bit. A number of my questions got answered in that. I still think I need to look deeper into this and really, I kind of want to understand more, like, if you literally go to the doctor for different reasons or the hospital for different reasons, what are you potentially going to pay out of pocket? Because like I said, some things you are paying out of pocket. For example, you go to the dentist, you get certain vision care, some other things. So I'm kind of really curious about, across the board, what's it going to cost you if you go for different services? Obviously, I believe it's going to be very, very much cheaper than the U.S. for any other service, probably. So, but I'm really curious on, I do believe that the average person in the UK, the vast majority support the NHS. And as someone who is in the U.S., doesn't understand the system really, never lived in a system like that. For the people that don't support it, what are the reasons? What have you experienced, that made you not supportive of this system? As an outsider looking in, just based off some, the little bit that I understand, I already feel like I'm probably, just for my monthly insurance, I'm probably paying my monthly insurance premium. I'm probably paying what the average person in the UK is paying automatically through the taxation, right? Our insurance, we got a bottom of the barrel plan. Understand that. We're not talking about something that's going to be very great insurance or anything like that. We're talking about a bottom of the barrel plan because I didn't want to pay crazy amounts of money for it. But that is about, for my wife and I, it's close to $700 a month. And understand, $700 a month, what's that get you? It gets you an $18,000 deductible. Actually, it was a $18,200 deductible, meaning that, for most services, hospital things, anything, most things, you're going to have to shell out $18,200 for the two of you. It's $9,100 a piece deductible before you're covered with stuff. So based off of that, it sounds like it's a much more beneficial system in the UK if you're generally paying, less than that, say $700 a month into your taxes for the NHS in the UK, because then the rest of it's, for most part, after that is covered for you. For us, that's not quite the case. We got deductibles, we got co-pays, we have co-payments, co-insurance, and other, different things we'd have to pay out. But luckily, not everything goes under deductible. Some things, for example, if you need to go to the doctor and you're going to, I don't know, you need to be seen for something minor, you can go to your local doctor and pay a copay, and you don't have to meet your deductible for that. But anything big, you've got to pay for it. You need an ambulance, you've got to pay for it. I'm kind of curious, like I said, on how more of the co-pays out of pocket for people in the UK work for certain items. And I'm also really curious, what is that percentage that people are paying out? So if someone in the UK, or let's say a couple in the UK, is making $75,000 a year, how much, or let's say 75,000 pounds per year, how many pounds are they paying out per year into the NHS system? To be covered? That would give me a better idea of what it's really costing someone. But another question I have, guys, is, so me as an American, if I was to come to the UK for a visit, I'm planning on it at some point when I have the ability to do so. I've got to save up the money to do so because it's going to be a really expensive trip, obviously, because I want to come for a month or so with my wife and my daughter. But do I need to have health insurance, or does the NHS in some way cover me while I'm there? I understand that when people come from other countries, for example, the UK, to visit America, a lot of people will get supplemental health insurance because they understand how crazy the system is here. If you broke an arm while you were here, that could be pretty expensive, So I'm just really curious, how does that work for an American coming to the UK? Do I also need to get a supplemental health insurance plan just to be covered there? Or is there some sort of NHS protocol that covers visitors as well? But I thought this was really interesting. A good first overall introduction to the NHS system. Guys, let me know in the comments. Do you love the system? Do you not like it? What's the positive and the negative experiences you've had with it? Do you feel like you get value for the money you pay in through your NHS taxation? Any other things you want to tell me about, please feel free to do so. I'm very interested in this topic. But I also want to hear from people who may not like the NHS system for some reason. I want to know, what are those reasons? Perhaps it's because have time limits. The amount of time to be seen for certain issues or operations, has it increased in the last number of years? Because I've heard that other places. So I don't know if that's accurate or not. But anyways, guys, thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others that you think I might want to check out. And don't forget to subscribe to continue to follow me on my journey to discover my British and Irish ancestry. Until next time, guys, peace.